Hello everyone, today we will be discussing on the retained testicle removal. We are placing the anesthesia, general anesthesia with Propofol. A clean drape has been placed to prep the area and incision will be placed in that area. Drape reduces spilling of blood in the area, probing through the points. Now we are placing the incision in that area. While we do the incision, cleaning the area is too much necessary to avoid any spillage of extra blood. Now the first testicle has been elaborated, which was present descended. Now this is the descended testicle and we are ligating it, both the spermatic cord as well as the testicular artery. We are using catgut for placing the ligatures. Should be properly ligated so that there should not be any bleeding edges, or else they may lead to your subcutaneous hematoma. The testicle has been elaborated, and after removal, now we are actually ligating through all the layers. Although this testicle is a descended one, so it remains under the scrotal pouch, but after removal, all the layers, especially the subcutaneous tissue and the skin, has to be properly ligated. Now we are ligating through the skin. We are using interrupted sutures, and Vicryl is being used, although you may use nylon or silk, but in that cases the stitch has to be removed after completion of the post-operative care. However, using Vicryl actually removes all these hassles because it's a absorbable suture. So once the wound has been healed properly, the suture will dissolve automatically. Now interrupted sutures actually help in both the post-operative care, and also has the advantage that by chance the animal actually leaks on that area or rubs that area and breaks a suture, so it holds up thoroughly, because the other sutures will remain, although not one or few sutures, although they may get clipped away because of erosion, but the other sutures will maintain that place. We are properly ligating through that area. The sutures should be placed such that they are not too much tense, or else they will cut through the skin. Using high quality Vicryl is advisable so that they may maintain the tension. This is the area after placing the suture of the descended testicle. Now we are probing for the second retained testicle. In this case, we were lucky enough that the retained testicle was seen in ultrasound to be placed in the inguinal canal, and was found after probing proximally to the left testicle, which was the descended one. The right testicle has been found close to the lower tract of the inguinal, or the lower flag of the inguinal tract, and by removing the fat using some blunt incisions, we get the testicle poised vicinally to the descended left testicle. Now we are giving the blunt incisions to increase the area as well as disperse the fat, and with a gentle push we get the testicle, and after getting the testicle we do the routine ligature of both the spermatic cords and the testicular artery, and also place separate ligatures on the suspensory ligament. And now we are placing the ligatures, and the testicle is ready for excision. After that, we need to actually place thorough sutures on all the layers. Here there will be 3 layers. One is the subcutaneous tissue, another will be the subcutaneous fat, and underlying there will be the muscle tissue close to the inguinal tract. The muscle tissue has to be ligated. Here we are using catgut for the ligatures, and the fat tissue has to be properly dispersed before ligature also, because if we do the ligature using the fat tissue, then the wound will not heal properly. We have placed ligature thoroughly on fat and subcutaneous tissue, and now here is the site post suture, and these are the testicles, both descended and the retained one. Thanks.